All new at 6 o'clock. Delays in tracking sexually transmitted disease cases is leading to a surge in syphilis across Charlotte.
That's what a whistleblower tells WBTV investigative reporter David Hodges. And David's on your side, pressing health officials for answers on a problem that's really impacting lives.
Christy McCrae was a nurse at the Mecklenburg County Health Department. She says she left because she had concerns about delays and a surge in syphilis cases that were falling on deaf ears. She reached out to WBTV because she wants people to know about it and she doesn't want it to stay quiet.
I felt totally handicapped. I felt abandoned. I felt like there was no one that was going to support me.
Christy McCrae has worked in public health for 40 years. The last 8 were spent working on STD and HIV surveillance for Mecklenburg County.
I just saw my hands were tied. Nobody, I felt like, were really listening.
She says she left because county and state health officials were failing at their key job to keep people safe.
I kept saying, women are going to start getting it. Babies are going to start getting it. And this is what we're seeing now.
McCrae is a disease intervention specialist. Her job is to track down cases and alert others who have been exposed.
DIS support response to other infectious disease outbreaks.
This video from the Nebraska Health Department shows how critical the job is.
DIS play a key role in public health.
But here in Charlotte, McCrae says staffing is critically short for those roles with Mecklenburg County and the State Department of Health and Human Services, which means delays in alerting people.
Well, it should take 2 days.
With the delay, are we talking weeks, months, anything in between?
Last I saw, it's anywhere from 6 months to a year.
An email obtained by WBTV confirms the staffing shortage. The director of North Carolina's Disease Outbreak Response wrote county health leaders about unprecedented levels of vacancies and delays in outreach to clients. The email included this map showing every state-funded position in Charlotte vacant. Does that make it harder to stop the spread?
Oh yeah, definitely. And that's what concerns me as a public health servant.
The most recent data on communicable diseases from Mecklenburg County shows an uptick in almost every STD. Most concerning to McCrae and others is the increase in HIV and syphilis cases. NCDHHS released this public health alert in December, warning doctors about a 538% increase in syphilis among women and more than 4,000% increase in congenital syphilis, where a mother passes the infection to her baby during pregnancy.
Unfortunately, we are a hot spot.
Dr. Wesley Thompson is founder of Amity Medical Group and has been treating HIV patients for 37 years. He says the work done by DIS workers like McCrae is critical.
Partner notification is vital to reducing the new numbers.
Have you noticed a recent lag or delay in the notification system?
Yes. Unfortunately, I have seen that. We still haven't recuperated from the loss of staffing, and you really do need people to do this.
I stayed as long as I can to ensure that the patients were taken care of.
McCrae says people need to be warned of the current outbreak, something she says local and state health leaders aren't doing.
I'm a public health servant. I have not spent 40 years of my life for nothing. I love what I do. I love the people that I served. And I want them to know that there's an outbreak out there, and I want them to be tested.
I reached out to both Mecklenburg County and NCDHHS asking for interviews. Instead, they sent statements and would not make their health leaders available. A spokesperson for Mecklenburg County wrote, Mecklenburg County, in close partnership and consultation with NCDHHS, activated a local version of the emergency operations plan to fill the gaps. We added additional staff, reassigned staff from other HIV, STI programs, and shifted workflows to clear the backlog. The county did not disclose what the backlog currently is. A spokesperson for NCDHHS wrote, review of statewide partner notification outcomes for 2022 compared to 2021 do not show delays in the time between the report of a positive HIV or syphilis test to the state surveillance system and when DIS performed outreach to those individuals. I've asked for the data to compare what they're saying to what McCrae and others are claiming. I've also been looking into what local and state health leaders have been doing to raise awareness about this gigantic increase in syphilis cases, but I didn't find much. More on that coming up at 7 on Your Side Tonight. Reporting in Charlotte, David Hodges, WBTV on your side.
David, thank you. Right.